The 1918 Spanish influenza was a worldwide pandemic that affected half of the global population within the course of 12 months. As the virus quickly spread, it killed an estimated 100 million people. The dreadful events of the influenza virus make this pandemic the most devastating one in history. This slidecast provides an overview of the progressive symptoms of the disease, its geographical course, and the social and economic disruption it caused. Furthermore, it will analyze the lessons learned from the catastrophe and how those help us determine and model modern-day pandemic scenarios. It has only been about a century since the contagious nature of many diseases has been accepted. In the past, influenza was believed to be caused by the influence of heavenly bodies, such as planets or meteors. The disease was also seen as being attributed to either volcanic eruptions or lethal gases released from under the Earth's crust. Although the origin of the pandemic is not known with complete certainty, the most accepted theory has been traced back to a military camp in Kansas in early March of 1918. Due to the already large numbers of deaths among soldiers within the camp, the first wave went almost unnoticed. It was not until the week of March 5th that the influenza was recognized as being the cause of illness among 522 soldiers. The disease spread all through North America, and by April, it reached France and Spain. The second wave began in the early fall of 1918 and had the largest number of casualties. This is due to the virus no longer being confined and concentrated within military camps, but rather spreading quickly through the public. By the end of September, all of Europe had also been infected, and during the following few weeks, the pandemic virtually spread throughout the entire world. This wave lasted about 6 weeks within each community and city, then died down. Approximately 80% of the infected people had common cold symptoms that lasted 3 to 5 days. These symptoms were mostly stuffy nose, cough, fever, joint, and body aches. The other 20% affected by the virus developed pneumonia, which caused the accumulation of blood and mucus into the lungs. Half of those patients died due to impaired lung function and reduced oxygen intake. Just after the second wave swept the globe and left nothing but casualties behind, the third and last wave struck in January of 1919. This wave did not have as many casualties as the second, but it had more than the first wave. The virus had spread again unevenly throughout North America and Europe. The contagious nature of the virus was finally becoming more understood, and large social gatherings needed to be avoided. Health officials were forced to instill the use of preventative health measures on the public for the first time in history. Many regions made face masks mandatory in public settings, and cities instituted bans on the public gatherings and therefore closed schools, cinemas, and entertainment places. As the number of flu casualties was rising in the fall of 1918, biologists and medical professionals faced the challenge of creating effective vaccinations for the public. Serums containing streptococci and pneumococci bacteria were created and administered, but found to have no effect on flu prevention or cure. This influenza triggered intensive research in the field of microbiology and immunology, and in 1931, the influenza virus was fully isolated. At the time of the influenza, there were far too few nurses to cope with the demand of providing care to such large numbers of victims. Women truly became models of compassion as they volunteered their efforts to help the ill. Their volunteerism resulted in somewhat blurring of the gender role division as men and women came together, working side by side to combat the disease. Although very few women had prior nursing experience, they volunteered as nurses and took care of the sick. The Red Cross Association took on female volunteers to help with childcare, meal preparation, the making of face masks, and other war or influenza contributions. Women often had a hard time keeping up with the high demands placed on them. However, through their dedication, they became valuable members of global communities. The pandemic had a traumatic context in terms of the ability to change family configurations and relationships. The deaths of parents or spouses made social support essential for many individuals. Thousands of children had become orphans and were taken in by relatives or put into the group homes run by female volunteers. Huge economic disruption came as casualties increased. Stores had to close and food production dropped due to the loss of workers to the disease. This in turn led to greater costs and more financial pressure on the families who lost their main provider, usually the husband. Low income around the year of the pandemic was proven to also reduce educational attainment and increase rates of disability in later generations. The large number of deaths caused insurance companies to take the biggest hit. In the United States, the virus caused life insurance losses of approximately $100 million. This amount would be nearly $19.9 billion today. In fact, during the height of the disease, a 96% increase in claims was reported by one of the biggest life insurance companies in America. Improvements in technology today has allowed us to better understand the events of the 1918 flu pandemic and use that knowledge to mitigate future outbreaks by understanding the components of disease. Strangely, the virus claimed the lives of mainly 20 to 40-year-olds rather than the very young or the old and the weak. Almost a century later, in 2014, Professor Michael Warraby discovered the answers to this age distribution pattern. According to his findings, most of those who died were born after 1889, the year when a smaller influenza pandemic of the H3 viral strain took place. Those born before 1889 were exposed to that virus during childhood and were then able to develop the immunity needed to fight off the 1918 influenza. Scientists have studied the statistical data from the Spanish influenza and have used it to predict the possible effects of a similar pandemic today. Increased global population, worldwide travel, and proximity of rural and urban areas could in turn increase the rate of spread of a pandemic today. However, our medical advancements and improved health provisions allow us to more effectively deal with the ill. It is hypothesized that a modern-day Spanish flu would result in 21 to 33 million deaths today, which is 70% fewer deaths than the 1918 pandemic. Initially, reduction of casualties could have been up to 90%. However, today's global air travel and aging population could increase casualties by 30% and 8% respectively. The influenza gave us an idea of the destructive capacity of pandemics and the unpredictable nature of such disasters. In fact, the pandemic was widely ignored by historians until the late 1970s, despite the shocking mortality. Since historians focused on making sense of human experience through controllable and calculable elements, the unpredictability of the pandemic made most historians uncomfortable. As seen, the Spanish influenza is the most devastating pandemic in terms of death tolls, as all socioeconomic classes, from kings to beggars, all suffered to the same extent. Its effects on social and economic structures then has taught us about the possible impacts on us today. We have learned to use our technological and medical advancements to better prepare us for such unpredictable disasters.